Sleeping with sciatica or low back pain, part 2. I'm Dr. Matthew Posa. Welcome to my page. My page is dedicated to people and families with tips and tricks so they can live the life they were designed to live. So don't forget to like, subscribe, and share this information with the people we know need it the most. In this video, I'm going to focus on a few more things that you can do in order to get relief, but I'm going to be focusing on creating stability. Just as a quick review, when you look at the spine, we look at it this way. Again, it should be nice and straight, but when you look at it from the side, it should have this lordosis, which is this curve that's happening in the low back. So this is a normal thing. But what ends up happening is a lot of people live their lives and their spine goes completely flat. Now, the problem with this is that there's a lot of little muscles in between the joints that help guide the joints. It helps stabilize the joints and the spine. And what it ends up doing is over time, continually staying in this position, what it does is it changes the biomechanics. It changes the way these things react to stress. And what happens is the moment that you try to go into a different position or you go to lay down and you make it worse, your body's going to react. This area becomes unstable. So exercising your low back is one of the best things you can do in order to create a little bit more of that extension, so you're getting that low back curve, but also it makes it more stable. And the more stable your spine is, the less pressure you're gonna have. So one of the things that you want to be able to work on is creating a curve, but then locking this in. So that's what we're gonna go through. One of the easiest things you can do at home when you want to get to bed and you want to decompress your spine is you can get yourself a small towel, hand towels, and then what you're going to do is you're going to roll it into a ball. And this is about 3 inches in diameter. And I like to just secure it with some elastics just to make sure it doesn't flop around on me. But it's got some decent amount of hardness to it. But because it's a towel, it will be soft enough. And all you're gonna do is when you have your spine, so you're gonna be laying down, because your spine, and most people's spines is pretty flat or they've gone forward and there's a lot of alignment issues. But what we wanna do is you wanna lay down, you're gonna put this in the low back, and I'll show you how to do this, and you're gonna arch your spine over. So your spine's gonna start coming over this, and that's gonna create the curve that we're looking for. So, and by doing that, you're going to be decompressing your discs and taking pressure off the nerves that are going into the low back, and they're also going into the leg. So if you're getting the sciatica or the low back pain, this is probably one of the best ways to do it. So what you're going to do is you're going to go lay down in your bed. You're going to take the towel. You're going to place it in where your low back would end up being, and then you're going to aim for the low back in these 2 spots right here. So you're gonna aim for where the dimples are. So that's where you're kind of aiming for. And what's gonna happen is as you lay down, you're aiming for that area. So you're going right underneath that. You're just gonna hold that with your hands, bring yourself back, and then letting that go. And then you're gonna bring your torso back. So you're now laying against the bed. You're gonna feel like your belly is going up towards the ceiling. Your pelvis is going to angle downward, which is normal, and you can hold this position. Now in this position, especially if you haven't done some of the other stretches that I gave you to do with the hip flexors, then a really easy way to help you ease into this would be to bring up your knees, which will put more pressure from your low back onto your bum and allow for your low back to arch. And in this position, you're gonna do this for 5 minutes. So it's an easy 5 minutes. You're taking in deep breaths and breathing out, and you're letting gravity push the spine, ease the spine into it. Now, for many of you who have a lot of disc issues, a lot of low back pain, you're gonna feel this. And so, instead of having maybe a 3-inch towel, if you need to ease into it, just go with a 2-inch towel. But you're gonna hold this position, arching your back, you're getting that curve back into it, and then when you're done, you're gonna slightly roll to the side. So you'll do this in the bed, so I'm gonna use my hand against the wall here, but you're gonna pull that out, just let your spine decompress from that. That's gonna feel really, really good. And then you can let your legs come out and you should be able to get the rest that you're looking for. If the bed is too soft, then you're not gonna feel this as much. So for some of you, that's gonna be a good thing because you've been in a lot of pain. But if you want a little bit more ground resistance, then you can do this on the floor. So I would do it on the floor right beside the bed. Again, you're putting that in that low back spot, and 5 minutes. All you need is 5 minutes with this. Next one that I'm gonna show you, it's called the dead bug exercise. Now, I really like the dead bug exercise because it's working a muscle that you wouldn't think would help you. And this muscle is called the transversus abdominis. So it's one of the muscles that are core muscles. It's a core muscle. It's really good for stabilizing the spine. And in fact, it acts like a corset. So it wraps from the back to the front, and it really keeps your spine in a neutral position. So this is one that they found that a lot of people who have low back pain, sciatica, and these type of issues, this muscle is not active because, you know, we sit all day, or it's been in a wrong position. Your spine's been off for so long that these muscles aren't being used properly. So we're gonna activate that by doing the dead bug exercise. And this exercise I've done on a few other videos, but you really need to find the time to do this one, and you wanna do this properly. So you're gonna lay on your back. You're gonna start, so you're gonna brace your core. So you're just gonna hold. And when I say brace it, it's like if I were to poke your stomach, you're holding that, but I'm still breathing, right? You're still being able to breathe. So don't hold your breath when you do this. You'll see my legs are bent. Now what I want you to do to start with this, because you're holding your core, you're gonna bring one arm back, and the key here is that your ribs, the bottom of your ribs, should not be lifting up. So if I bring my arm back and my bottom ribs feel like they wanna lift up, you're doing this wrong. You're not contracting your core. So in review, you're gonna brace your core, one arm's coming back, nothing's moving, that's fine. Then you're gonna do the other arm, nothing's moving. Good, so you're stabilized. So I like to put my other hand just to kind of feel that, make sure that's happening. I'm still breathing, I'm still okay, I'm not turning red, I'm not going crazy. And then you're gonna do both arms at the same time. Anybody, if you got a lot of shoulder issues, just go until the point that you can. The point here is that you're activating your core muscles, your transversus abdominis, while doing this exercise, which is gonna stabilize your spine. So again, it's both arms, you're keeping this nice and tight, and you're bringing it down. Now, if you can do that successfully, then you're gonna move on to the next stage. And the next stage is moving your legs. So again, you're careful with your pelvis, and I'm gonna lift one leg up. I'm just gonna bring that up to about 90 degrees and bring it back down. And then my pelvis, you don't want your pelvis to rock. So you're gonna bring this one up, you're stabilizing, you're actually fighting that movement, and you're gonna bring it back down. And then you're doing the opposite side again. You're bringing, there should be zero movement in your pelvis, zero. And then this one comes back up. So now what we're doing is we're working the entire muscle, the complexity of that muscle. And then to tie it all in, so if you can do the arms, you can do the legs without rocking your pelvis. Then you're gonna move on to the next stage. So in review, one arm at a time, I would do 10 on one side, 10 on the other, and then 10 this way. So you're doing all, so it's 3 sets of 10. If you can do that, then your next exercise is gonna be 3 sets of 10. Again, you're doing 1 and 2. So 3 sets of 10, 1 and then 2. So you're just repeating 10, 10, 10, right? You're just doing 10 on each leg, but 3 sets of that. If you can do that, then you move on to the next stage. If you cannot do any of those stages, then you're gonna stay there until you can do that properly, and then you would move on. So you might be there for about a week where you're working on just the leg part, because you can nail the top part, but the leg part needs work. And then you're gonna go on to the final one. Now the final one is where the name dead bug comes from. So the legs are at 90 degrees, your arms are out, and this is gonna take some coordination. You're gonna bring, let's say we're gonna start with the left. I'm gonna bring my left arm back and my right leg down, stabilizing my core. So again, it's up like this, and it's down and then back up, holding my core, still breathing. And I like to breathe in on this one, so like that. And hopefully you can hear that through the mic. right? So you're holding your core. Now that's going to be really tough for a lot of people because it's the first time you're doing it. But when you do this, and you do this right, not only will you might even see it in your waistline, but you're going to notice your core is getting super tight. So again, it'll be 3 sets of 10 in order to get that muscle active. Now I really hope a lot of that made sense. You can try that at home. You could decompress your spine again from the side like this, so you're putting that curve back into your spine. Or the other way is that we're locking this in, and that's with the dead bug. So try those at home. Now, if you're laying down in bed, let's say laying on your side, and you're getting like the side pain, well then there's other muscles in here. And that could be another video that I should be probably doing for you guys, but that is a whole other problem. And that really has to do with a lot of the muscles of the glute. It has to do with the muscles like TFL, and it has to do with the ITB band and how those all coordinate together, which are hip stabilizers. And so you're gonna wanna do those airplanes in one of my previous videos. And if you haven't checked that out, make sure you check that one out, because the hip airplane is one of the best things you can do in order to open up your hips. And that's where a lot of maybe your low back pain is coming from. The other thing, and just clinically, this is what I see all the time, is a lot of these joints, again, are not in the right position, or they're twisted the wrong way. There's literally like a twist to the spine. The pelvis is out of alignment. That is the reason why this is happening in the first place. You need to restore proper alignment and restoration of proper movement in order for your body to heal. And so I would urge you, make sure you're going to a corrective care chiropractor. Make sure that they're doing the full assessment. You know exactly what's going on. They lay it out for you, and you have a treatment plan in place in order to correct this. This is one of the biggest issues that we're seeing constantly around, and it has to do for many different reasons that this is happening. But you need somebody who understands the biomechanics, who understands how your body needs to be put back in the right place, and that can help guide you through that process. And if you need help, please leave a question down below. You can comment down below, and I always do my best to answer those. I hope this video brings you relief, and if you need to reach out, please do. I'm here for you. Until next time, we'll talk to you soon.